Hi, I'm Dr. Matheson Harris in Salt Lake City, Utah. Ear gauges are large earrings which slowly stretch the lower part of the earlobe to a larger size. Many people later wish to have the gauges reversed. Unfortunately, just removing the gauge from the earlobe will not reverse the change. The skin will be stretched out and will never completely return to a normal appearance. A minor surgery in our office can close the hole and reshape the ear to a normal appearance. Scarring is minimal and the ear can even be repierced at a later time. Ear gauge reversal is performed by first numbing the ear skin with lidocaine or similar numbing medicine. Next, an incision is made around the inside of the hole to remove the stretched out tissue. Careful markings are made and the skin is brought together in a normal shape. It's closed with the dissolvable stitches and then covered in antibacterial ointment. In most cases, a straight, thin scar will be the only visible sign that you've had it done, and this will fade with time. You can even re-pierce the ears several months later. Stretching them again, however, wouldn't be advised. Complications are rare, but can occur, including an undesired shape and possible asymmetry, both of which can be addressed with an additional procedure. Pain is very minimal, and bleeding and infection are extremely uncommon. We also frequently repair torn earlobes due to heavy earrings and perform earlobe size reduction, both by way of similar techniques. If you have any questions, please email me directly or call our office. Thanks for visiting Utah Eyelid and Facial Plastic Surgery. We look forward to helping you feel and look your best.